several of these blood tests now that are approved for the diagnosis of Alzheimer's disease. And this Quest product combines two of them into one panel, if you will. And they found it to be highly accurate in its ability to diagnose Alzheimer's disease. The positive predictive value is 90%, meaning if you have a positive test, 90% chance you have Alzheimer's. The negative predictive value is 99%, meaning if you have a negative test, 99% chance you don't have Alzheimer's disease. So for people over 50 that are showing signs of mild cognitive issues, this test can really help distinguish whether it's just, hey, you know, a little bit of aging, maybe a little bit of ADHD, depression, stress, whatever, or if there's something really going on dementia-wise.
Interesting. Well, I just turned 57 recently, and me and all my peers, we definitely have cognitive issues. I don't want to make light of it, but this is the age when you start forgetting stuff.
Right.
And so, but if there's no downside to this test, well, I'm just thinking, like, you know, I just friend who's sadly, I was just at his dad's funeral. His dad led a long life, but those last 12 years, he had Alzheimer's. And I'm thinking, certainly for my buddy, he's probably already thought of it. I mean, come on. But if he could be genetically predisposed to Alzheimer's, just get the test.
Yeah, I mean, you know, well, first of all, most Alzheimer's is probably not genetic. There might be a genetic component or predisposition to it, but it really is a lifestyle environmental disease. I think is what we're learning more than, I mean, there are certain subsets of Alzheimer's that might be genetic. These probably are people that have like Alzheimer's onset at a really young age.
Right.
That's more likely to be like a true genetic Alzheimer's. But for most people, it's going to be an environmental thing. And, you know, it ties into all the usual stuff we talk about, right? All the stuff we were just talking about, all the lifestyle stuff. Those are your risk factors. But this test can diagnose. So like for everyone that's having some cognitive issue, which is very common when you get past 50, right? The mild stuff. I forgot this. I forgot that, right? Who can we tease out that actually has a real problem developing? This test will do that. There's all kinds of ethical considerations that come up with this, for sure.
Why is that?
Oh, do you want to know?
Oh, I see. Yeah. Do you want to know? What if your kids want to know?
Right.
You know, what if your spouse wants to know?
Right.
Yeah, interesting.
And you could be highly functional and fine and get a positive result. And okay, 10 years from now, you got a problem. I mean, the thing I will say is that different than before, and if you remember our episode with Dr. Napoli, the first episode we recorded, we have treatments now for Alzheimer's, like real legitimate treatments that can really change the natural history of the disease.
Right.
We didn't have those 5 years ago, 10 years ago. So there probably is some value in knowing who has Alzheimer's.
I think I would want to know. I think because, you know, when people get diagnosed with Alzheimer's, it's, I mean, you of course know better than me. It's not exactly a wonderful process. I mean, I think there's you start to see some things and they slip and this, and then, you know, God forbid, maybe they forget something important, or God forbid, you know, space out when they're driving or something like that. You'd be, you know, prepared. Now, I guess obviously you don't know exactly when it's going to hit you, but at least you know what's going on, and you know, well, what's the therapy plan?
Definitely. Yeah. And the treatments we have, which are all new in the last couple of years, and I mean like literally the last 2 years, they work better the earlier they're started. That's one thing we think we know. So like that's the value. You diagnose someone, you treat them early, and maybe you can radically change what happens to them 5, 10, 15, 20 years down the road.
Yeah.
And who knows what's coming? You know, this is just the first wave of these treatments. There's going to be other ones that are probably even more effective.